This worm has been in this eye for almost a month, mainly because the primary vet was trying to treat it with medical management, and these worms should never be treated with medical management. If they die inside the eye, then that leads to a severe inflammation inside the eye, and that leads to destruction of the eye. The only and the best treatment for this condition is to remove this worm as soon as possible surgically. You cannot kill this worm inside the eye, because killing this worm is not a good idea. So I'm right now giving blocks so that he will lose control over his eyelids. I'm basically just disinfecting this eye. I'm just cleaning the periocular area. This is called as Retrobar Block. I'm going to give in a local anesthetic injection behind the eyeball. Made a cut in the anterior chamber. Just going to inject some visco. This is a blunt needle. So the worm is coming out. It's coming out. Okay. And we are done. So that's the one. There is no bleeding, nothing. The eye is looking great. I left the visco in. It's mainly to maintain the eyeball. And soon he will start producing his own aqueous, which is his own fluid inside the eye. That incision seals very quickly, so that's not a problem at all. And we are going to send this off to the lab. Be aware. If anybody is telling you that let's give medications and kill this worm, that's wrong. That's absolutely wrong. That worm needs to come out with surgery. Another important thing is that if you take an incision, this is for the vets, and if you squeeze the eyeball, that leads to destruction of the eye. The eye is a very fragile structure, so the worm has to gently come out. This is the best way that you can actually take the worm out.